And good evening, everybody. I'm Len Cannon in the KHU 11 newsroom, along with Mia Gradney. We are following some breaking news. Here in just a couple of minutes, we are waiting on a news conference in Fort Bend County where health officials are going to be talking about what potentially could be the first case of the coronavirus in the Houston area.
And here's what we know. We have heard both from the health department there in Fort Bend County, and just within the last 20 minutes or so, we received a release with information from the Texas Department of State Health Services. We know the patient is a resident of Fort Bend County who recently returned from travel abroad and is currently isolated in the hospital. Fort Bend County health officials saying that this individual is in stable condition and that this individual has a presumptive positive coronavirus result.
And so I'm going to let you explain that, because people are saying, well, what does that mean, a presumptive positive case? Explain that to folks.
So essentially, and this is all based on information that we are receiving from health officials. This is directly from the Texas Department of State Health Services. That means the test was performed at the public health lab in Houston, and it will be confirmed by testing it at the Centers for Disease Control and Prevention. Essentially, they do an initial test, then the CDC has the final say, the final test, and confirms that it is in fact a positive test result.
So just to let you know, our reporter Marcelino Benito is at this news conference that we're going to go to here in any minute now. There are several questions, obviously, that we hope to get answered. For example, where did this gentleman travel to? How long was he there? When did he first report that he was not feeling well? Where did he go? And in the interim, how many people in Fort Bend County did he come into contact with? We have seen other cases, the most recent in New York, where a guy came down with the coronavirus. He ended up infecting 9 other people, including folks in his family. So that is a question every time there's a case that pops up that officials have to answer, and that's one of the things we'll have to ask at this news conference that you see people, that's the podium right there down in Richmond.
Yeah, they're starting to file in there. We do have some surface information, I will call it, that we did receive from the Fort Bend County Health Department. I had said that the man, of course, had traveled abroad. He is in his 70s, and remember we said those most at risk are those who are older. So this man is in his 70s, he is hospitalized, he is in stable condition. So we were talking about, and you had mentioned, Len, that with the other cases that we've seen, there's been research into who has this individual exposed themselves to, right? So there is an investigation now that we understand Fort Bend County Health and Human Services has started what they call an epidemiological investigation, and they're leading the efforts to quickly determine exactly those things that you had mentioned, Len. Who did this person come in contact with? Who has had close contact with this individual? And we're learning we're about 5 minutes away from the start of the news conference here. We're going to hear from Fort Bend County health officials and quite possibly also Houston health officials as well too. Dr. David Pearce on the forefront of this for the city of Houston, likely to join his colleagues there in Fort Bend County as well to discuss this further.
One of the significant points about this particular case that health officials are pointing out is this is the first case in Texas, potentially the first case where somebody has been infected who was not part of the group of folks who were on that Diamond cruise ship in Asia. Remember, they brought a lot of those folks to the United States, including to San Antonio. And so those were the only cases first in the U.S. And for the first time in Texas, it's happening in other states, but in Texas, where somebody was not a part of that cruise ship, this is somebody who traveled. So we're waiting to find out, so where did this guy go? How long was he there? Where is he being treated right now? And obviously there's a network of folks that he may have come in contact with. If you or I had been diagnosed, Mia, then certainly people would want to know where, okay, so who did you come in contact with and how long has it been? So these are the questions we hope that health officials, both state and the county folks, will be able to answer here in just a couple of minutes.
All right, I'm following a lot of your comments on Facebook right now as Lynn and I are awaiting this press conference to start, news conference to start from Fort Bend County. And I'm seeing in a lot of your posts a lot of concern, understandably so, right? But we knew this was inevitable, us being a city this large, that ultimately we were going to see a case here in Houston. And we really want to remind everyone the best thing you can do right now is to remain calm in this situation. Look for the facts. not the information out there on social media that is second, third hand. Look for the facts. That's why we're here ready to broadcast this news conference in its entirety for you so you can get the facts. So hopefully you can get your questions answered and feel more comforted by this as well.
Yeah, we've been doing a series of reports all week from our investigative team with Cheryl Mercedes, getting facts and questions to answers a lot of you have been sending in. And a lot of times the questions are based on some innocuous comment that is made on Facebook. The source, we don't know where it comes from. It is just a rumor about something about the virus, unless it is coming from a trusted source of people who are doing an investigation, like we're going to hear right now from the health officials about this individual in Fort Bend County. That's what you have to depend on. And so as we walk you through this story that is going to continue to develop, we've been following this now for a couple of months, and now it appears that the Houston area may have its first case. We want to continue to bring you the facts to prevent any sort of panic. I know some people will have anxiety and be uncomfortable, but let's stay with the facts. By and large, all health officials, no matter what state, are saying that the risk is low. We talked about people going to the rodeo. The folks have said, look, the risk is low. 80+% of people who even end up with this virus, the symptoms are mild. So let's keep that in mind.
And just to echo that thought, Len, the Fort Bend County health officials, when they put out the statement earlier this evening, they said remaining calm is of utmost importance in this situation, and just doing the practical things, taking those steps to protect you and your family as well. Some things they want the public to keep in mind and to help with. First and foremost, do not go to the emergency room unless it's essential. It is allergy season, it is flu season, so if your throat is a little itchy at first, do not panic, right? Truly assess what is going on with yourself before you head to an emergency room, a hospital, or even the doctor's office. Emergency rooms, they need to be there to serve those with the most critical needs. So, unfortunately, if you just have a runny nose for whatever reason, whether it be allergies or not, you show up at the emergency room and the next person, then you are basically slowing down the process for those who are in the most dire need to get the help that they need. And remember, we can't say it enough, and I feel like a broken record with this, but practicing basic hygiene, right?
It's important.
Washing your hands before and after every meal, washing your hands when you get to work, washing your hands while you're at work, reminding the kiddos at school, the same exact thing. These are all things we should be doing anyway, even every day.
During the flu season, this is another virus similar to the flu. So we want to remind people to continue to do that. And officials, we hope to hear from here any minute now down in Fort Bend County about a potentially first case in the Houston area, a man who is now in isolation down there, and we're told is stable. That is good news, in his 70s. And we hope to get some answers to this man, and I don't know if we'll get an identity, probably not, to protect his own
likely due to
safety.
HIPAA reasons, I would imagine,
absolutely.
for him and for his family's protection as well, too. I doubt that they'll release.
So just so people, another really handy thing, everybody's got their phones. If you go to text 713, what's the number?
526-1111.
1111. And you put in facts, then we will then instantly send you an updated link on what is going on with the coronavirus. That is very handy, useful information. If you're wondering, okay, what's going on here, then simply go to that number, put in facts, the word facts, and then we will send you the link. And you've been asking, some people say, okay, well, what is the coronavirus? How bad is it? It is merely a part of a family of the coronavirus. We've talked about Sars in the past, MERS in the past. Those are all part of the coronavirus family. This they have labeled COVID-19. So it is an upper respiratory illness. The symptoms are very similar to the flu: coughing, fever, discomfort. It's all very similar. So unless you have a test, you may not know whether it's the coronavirus, COVID-19 as they're calling it, or the flu.
Yeah, and we were talking about being able to text 713-526-1111 for a link with information. And just to give you some basics, kind of a big picture of where we are with the coronavirus today, there are now sadly 11 people who are dead in the U.S. as a result of the virus. We've had 10 cases in Washington state and 1 in California. Congress is now poised to pass an $8.3 billion package to fight the virus. So there's very much this concentrated effort now to combat and prevent the spread of this virus, but it really starts with us in each of our homes, in each of our workplaces, and so forth, and taking those precautions and hand washing, you know, and if you blow your nose in a tissue, please don't leave it on a hard surface. Make sure you dispose of it properly. If you don't have a tissue, you know, into your sleeve and so forth. Just be considerate and thoughtful of others and yourself as well, too.
So just as a, you know, a point of reference and comparison, you and I covered the Ebola crisis a few years ago, you might recall, and there was great alarm and panic when that happened. There were cases up in Dallas, I believe. The reason in that case that there was so much panic with the Ebola is because the death rate was so incredibly high, a very dangerous thing. This is a completely different ballgame here, folks. So, as we said, there have been more than 80,000 cases around the world. Most of those cases have been in China, where this virus originated. And so here in the Texas area, in the States, in Texas, it's only, what is it, about 100, I believe. No, I'm sorry, in the U.S. is like 120, I believe, is the accurate number. So think about that. I mean, those are very low numbers, and I just think that all health departments, schools, they're all taking a lot of precautions to make sure that they stay ahead of the game so that if something comes up, they can be ready to treat it and deal with it, because we do know that this particular virus does spread very quickly. We talked about a case in New York City that is going on right now. There was a guy who works in Midtown Manhattan who came down with the virus, tested positive, and that virus then spread to 9 other people, including his son and his wife and the woman who took him to the hospital. So that tells us how quickly this virus can spread, even though the symptoms typically are mild and the death rate is relatively low.
Yeah, a lot of you echoing, of course, and understandably, that you're scared. Is this Houston? Let me give you some perspective provided to us by the Texas Department of Health Services. And this, once again, from the officials there, having a COVID-19 case in Texas is significant development in this outbreak, but it does not change the fact that the immediate risk to most Texans is low. And this is from the commissioner of the Texas Department of State Health Services. He adds, this travel-related case reinforces the fact that we should all be taking basic hygiene steps that are extremely effective in limiting the spread of COVID-19 and all respiratory illnesses. So for those who are fearful and understandably concerned at this moment, keep in mind that the people entrenched in this right now are telling us that the immediate risk to most Texans is low. And it looks like we have some folks assembling now at the podium. It's going to be any moment here. Just as soon as they start talking, we're going to start here. Let's go ahead and listen in.
Ready, everybody? Good afternoon, everyone. I am KP George, your Fort Bend County Judge. As we have promised, the information, as and when the information is available, we do everything in our power to keep our residents and all jurisdictions informed about the situation. We are working around the clock with all local, regional, and statewide health authorities to monitor the situation and update the public. While this is a serious health threat, we encourage residents to rely on verifiable source of information and remain calm. Next, I will introduce a team of experts throughout from this region. We are blessed to have some of the top public health officials with us today. With that, I will introduce to you Fort Bend County Health and Human Services Director, Dr. Jacqueline Minter, to provide an update on the individual situation. Thank you. Dr. Minter.
Thank you, Judge George, and good evening. First, I would like to acknowledge the presence of our regional local health authorities, Dr. David Purse from the City of Houston, and Dr. Umer Shah from Harris County. As you know, diseases and disasters do not respect jurisdictional boundaries. We are fortunate to have a great relationship and a great partnership within this region, and I sincerely appreciate the support of my colleagues. Thank you. At 4 p.m. this afternoon, I was notified that a person who resides in Fort Bend County has a presumptive positive test for COVID-19. The test was performed by the Houston Health Department Laboratory and is being sent to the Centers for Disease Control in Atlanta for confirmation. If confirmed, this represents the first positive COVID-19 case in the state of Texas from a non-repatriated person. This person is a man in his 70s who traveled abroad and became ill after his return to the U.S. He is currently hospitalized and in stable condition. As this case was associated with travel, at this time, we still have no evidence of community spread of COVID-19. While we know this news is concerning, it is not unexpected. We have watched the numbers of cases increase daily across the U.S., and it was just a matter of time before Texas announced its first case. This is a rapidly evolving situation, and we know it's unsettling for our residents. We want you to remember that there are things that you can do to protect yourselves and your families. Remaining calm is of utmost importance. You can help by not going to the emergency room unless it's essential. Emergency rooms need to be able to serve those with the most critical needs. If you have symptoms, like a cough, fever, or other respiratory problems, please contact your doctor. Secondly, you can practice healthy hygiene habits every day, and those will help to prevent the spread of respiratory illnesses like COVID-19. Wash your hands often with soap and water for at least 20 minutes, especially after going to the restroom, before eating, after blowing your nose, coughing, or sneezing. If soap and water are not available, use an alcohol-based sanitizer with at least 60% alcohol. Avoid touching your hands to your face, eyes, nose, and mouth. Avoid close contact with people who are sick. Stay home if you are sick, and cover your sneezes and coughs. If you don't have a tissue, cough into your sleeve, not into your hands. And remember to wash your hands after coughing or sneezing. You can clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe.
Thank you, Dr. Minter. At this point, I wanted to invite City of Houston Public Health Authority, Dr. David Purse, to give you an update. Doctor?
Judge George, Dr. Minter, thank you for allowing the City of Houston to participate. We, with the City of Houston, we're going to have a press conference of our own this afternoon or perhaps tomorrow morning to announce that our lab now has the capability to test for the virus that causes the COVID-19 illness. As you know, there were problems when the test was rolled out earlier. Those test issues have been resolved. We were doing our own internal testing and verification, which is part of the normal process, and that includes testing some actual samples. And so that's what happened today, was we did a test on some actual samples, which we were going to ensure were all being run properly, which we have in this case before we made the public announcement. The test results you have heard are characterized as presumptive positive, and that's the way that they are described. However, the CDC also points out these are, in fact, actionable results. So we believe that the result is, in fact, an actual positive. It will undergo a confirmation process at the CDC, but at this point we have no reason to believe that there's anything other than accurate, and it is, in fact, actionable. And so this is why we are moving forward and acting and behaving as if it's actionable, because it in fact is. And so beginning tomorrow, the City of Houston's laboratory will have testing capability. We're going to be coordinating that messaging to all of the clinicians, hospitals, doctors' offices, and clinics in the region. There is a process which they're familiar with, and we will reorient them to in terms of how the testing can be done here locally. For those that have already submitted tests, they know that process. There are some very minor tweaks to it due to the fact that we'll be able to test locally. The big difference is that we're going to be able to get test results much more quickly than we have in the past several weeks. Having said that, there is still a limit to the amount of tests that we can run in a day. So I strongly encourage people to be patient with us as we get the testing process up and going. We don't want to wind up in the situation that the CDC has been in, where there are more tests that are coming in than we can run in a day. And we will, in fact, be prioritizing tests based on the need, based on the description of the patients. For example, as someone who's had no travel and has no exposure to anyone with any illness, and he has no symptoms, but he just simply wants to be tested, they will not be tested ahead of somebody who has reason to be tested, because they may have a travel history, or they may have been in an area, whether it be internationally, where there's cases moving around, or if they have symptoms. So there will be a prioritization that will occur. Thank you.
Thank you, Dr. Pearce, for that update. And at this point, I wanted to invite Harris County Public Health Authority, Dr. Umesha. Doctor, please come forward.
Thank you, Judge George, for having us here this evening. I want to underscore what my colleagues have said. I also want to express gratitude for your leadership, and Judge Hidalgo, as you all know, with Harris County, Judge Lina Hidalgo remains committed to working with you and our regional elected officials. Dr. Minter, thank you for your leadership as well in this. I know that this is a challenging situation, and I want to underscore the message that she has provided, which is it is a concerning development that we have had our first presumptive positive case. However, I want to make sure that everybody understands that that is something that we have been planning for, we have been preparing for some period of time. The reason that Dr. Pearce, myself, and others stand together is that our regional public health departments have been working together, we've been planning together, and we've been planning for a number of different scenarios. And so it was a matter of time before we were going to see the first positive in our community. As Dr. Minter has said, we do not have evidence of community spread. But this is a good reminder to all of our community members, including within our healthcare community, but also our community members at large, that this is the time for all of us to continue to do all the things that we can do to prevent ourselves from getting sick or spreading that to somebody else if we ourselves are sick, which is, again, washing our hands, covering our coughs, and if you yourself are sick from any type of respiratory disease, we want to make sure that you do not go somewhere where you can infect others. And whether that's not sending your kids to school, making sure that they don't get others sick, or making sure that you don't go to work, making sure that you don't go to large gatherings. If you yourself are sick, as Dr. Minter said, we want to make sure that your first step is to contact your healthcare provider. Harris County Public Health remains supportive of the efforts here. We remain supportive of all the activities that are happening across our region, and we remain monitoring along with our partners to make sure that we continue to protect our communities. Thank you.
Thank you, Dr. Shaw. At this point, I just wanted to invite Fort Bend County Fire Marshal and also Emergency Management Coordinator, Mark Flathouse, for an update. Mark.
As the Emergency Management Coordinator of Fort Bend County, we're moving our Emergency Operations Center to Readiness Level 3 to assist Health and Human Services of Fort Bend County under the direction of Dr. Minter and the County Judge. We're here to supply not only resources, but also help coordination with all the local jurisdictions as we move forward with this.
Thank you, Mark. I just wanted to conclude this conversation here. All residents, I repeat what most of these health authority members mentioned. I encourage residents to take every preventive step to avoid spreading respiratory illness by covering cough and washing hands frequently, staying home if you are sick. I assure all residents in Fort Bend County and in this area, all the top local, regional, statewide entities and experts are on top of the situation. We will do everything possible under our power to ensure that safety and well-being of our residents are the most important thing for us, and we will continue to work and monitor the situation and keep updating our residents ongoing. At this point, we will encourage a few questions, and I will invite respective authorities to come and answer those questions. Yes.
Many of our readers believe that the media is blowing this out of proportion. 60 to 70,000 people a year die of common flu. They're saying the media is blowing this out of proportion. How do you guys respond to that?
So do you, Dr. You wanted to, please go ahead.
Thank you for that question. I think what we have to remember is that there are a number of real concerns that are out there. We have been watching what's been happening in obviously China and Asia, and looking at what's been happening across the globe. It is true that there are thousands of people that die of seasonal influenza every single year. In fact, we are still in the middle of flu season. And so what we want to remind people is that it is absolutely critical that we take all the steps that we can take on a daily basis that, by the way, protect you from a variety of illnesses, including influenza, but also other respiratory conditions. Why this is concerning to us as public health officials is that this is a novel virus. It has made a jump from animals to humans, and because there has been evolving information related to this, we just can't let our guard down. And that is absolutely critical to the work that we do. We remain prepared, we remain committed to protecting our communities, but this is evolving, and we want to make sure that we have all the information to our community members so that they can do what they can to protect themselves as well from a variety of diseases.
Do we know how many people that patient has come into contact with?
So we've started the investigation. We have some details. We do not have all of the details. It would be premature for me to share them now. As soon as we have those, that information available, we will.
How long, do we know how long it took for him to demonstrate symptoms?
Right, again, we don't have all the details. We have started the investigation, but we don't have all the details as of now.
Do we know how he came to the attention of medical personnel? Was it through his doctor? Did he
It
go to
was.
the emergency room? His own doctor?
Mm-hmm.
Where and when did he travel?
Yeah, go ahead.
So that information is information I can't share with you about that patient right now.
Has he been out in the community or is he work?
Right, so again, that information is evolving. We don't have all the details. When we have all those details, we will be able to share.
Can you talk about any of the symptoms he experienced to make him go to the doctor?
Right, so I think that would also be a violation of HIPAA, so I don't want to talk about those symptoms, but he presented with the symptoms that most of the people that would be tested would present with.
Is he in a compromised medical condition?
He is in stable condition.
But I mean, did he have pre-existing disease?
Oh, he did not. He did not. According to his doctor who I spoke with last night and this morning, he did not.
Is there any contact tracing going on already?
There is. It has already started.
Can you just look at the community and you share a little bit about that?
I cannot because it's ongoing and it's just started. As soon as we have more information, I will share.
Can you tell us where the hospital he's in or where this happened?
That I cannot share.
You can't tell us what part of the county?
I cannot share that information.
Well, how should people in Fort Bend react? Should they continue on about their lives? What should they do?
Absolutely. As we said before, this case was associated with travel. So we do not have any evidence of community spread at this time.
This may be a question for Dr. Purse specifically. The lab able to start testing tomorrow, would that mean that results will no longer have to go to the CDC, or will they still be sent to CDC?
That's a great question. So we will be able to do the tests locally. It takes about a day for the whole testing process to occur. So the answers will get back to the clinicians generally the following day after the specimen is submitted. The presumptive positives will then go to the CDC for confirmation, but a presumptive positive is an actionable positive. So we'll be treating those as if they are actual positives. In the unlikely event that there's an issue determined at the CDC, will then address it then. But based on what we know at this point, we think that's going to be a rare event. But as you remember, there were problems with the testing before, and so the CDC is going to this extra level of scrutiny just to make certain that what we're calling presumptive positives are in fact positive. But we don't expect any problems in the testing that has gone on the last couple of weeks with this. The preliminary work with this current process of testing has been quite satisfactory to the people in the lab. They're very confident that it's extremely reliable. So.
How long ago did you do this test, and do you have any other tests going on for Fort Bend County people right now?
Oh, that's, well, other people being tested.
Other testing in Fort Bend County, we have this test out. I do not know of the other tests that we have out.
When can we expect the results from CDC?
1 to 2 days. I believe it's 1 to 2 days.
Did you say there are no other tests out, or you don't know
I am not aware of any other tests
in
out
Fort
right
Bend
now.
County? How about in Harris County? Are you
So,
conducting any other
yeah,
tests?
so I want to reemphasize. Dr. Purse and I have had this conversation, I know, with the media on multiple occasions, and we want to continue to reemphasize that it's absolutely critical that what we are doing is we want to make sure that we do not have any situation where any individual in our community who has been traveled and been exposed somewhere for some reason feels hesitant or not wanting to come forth to a public health authority, to a healthcare provider. And so as regional public health departments, we have decided that the investigation of diseases that we do all the time with our healthcare providers is happening as it happens every year, even before novel coronavirus. It's going to happen well after novel coronavirus. We're going to continue to do those investigations. But we're only going to be providing information when we have a confirmed test positive. And as you know, that means that we remain committed in Harris County, City of Houston, and our region to be really talking about confirmed cases and not a lot of rumors that are out there, because there have been significant amount of rumors about this. And so I know it's difficult because people want to have all this information about how many and what are the numbers, but we're doing this out of an abundance of caution because we really do believe that there is a potential that someone may not come forth to public health authorities because they feel that that information may be getting out and they will somehow be singled out, and we want to be really careful of that. So that's the reason that we're not providing that information. Dr. Purse, if you have anything to add to that, but I just want to say that's the reason that this is really about confirmed case and the presumptive positive that Dr. Minter described.
With viruses usually being seasonal, do you all believe that when it starts to get warmer that this may die down a bit, go away?
You know, I think it's a really good question, and I'm hopeful that we will have an answer in the summer months, but we don't know. The honest answer is that this is an evolving situation, again, with a novel virus where we may have a lot of potential theories of what's going to happen in the summer months, but we don't know. We really don't know how this is going to play out. We're hopeful, though, that as we get through flu season, and as we know that summer in Houston starts pretty quick, so we're hopeful that that is going to give us some relief across the country from, and even across the globe, from the amount of activity that may be seen. But we just don't know. It's too early to tell.
Can you tell us what airline, what airport this patient traveled through?
No, I can't share that information.
All right, we're gonna go ahead and cut
Yeah.
this short, Dr.
Okay. Once again, I just wanted to thank each and every one of you to be here, and I appreciate you're getting this information out to our residents. And I just wanted to promise our residents, like I said, I'm repeating again, we will do everything possible. All these authorities, as you can see, they're not just from Fort Bend County. They're coming from this region because we are taking this seriously, and we care about our citizens' well-being. And so we will continue to monitor, continue to update our media. And thank you for all the good work you are doing. Once again, thank you. Good night.
Is there anybody who can do the Spanish version of this? I can take questions outside, Dr. Chris. If any of you
All right, we have been listening to Fort Bend County health officials, City of Houston health officials, and state health officials about a presumptive positive case of the coronavirus of a man in his 70s in Fort Bend County. Now, here's what we do know. We know he's in his 70s. We know he did not have any pre-existing conditions. Here's what we don't know. They are not saying, obviously, for reasons of,
his
security,
own personal security,
his own personal security, and HIPAA laws. We don't know where he's being treated. We don't know. They're not saying how many people this gentleman came into contact with. They're not saying what airport he flew into. They're not saying where he traveled to. So all those things we still don't know, but we do know the protocol for someone who does test positive is they do check everybody that person is coming into contact with. Those folks we still don't know.
Right, exactly. And we do know that he had traveled abroad, and some of this information is still under investigation, exactly how many people he came in contact with, and then some of it is a matter of personal security. So others who feel as though they feel those symptoms coming on don't come forward. There's no evidence of community spread. That was the big takeaway here from the health official in Fort Bend County, Ms. Mentor, Dr. Mentor, talking about there is no evidence of community spread. They believe this is a case of someone who had traveled abroad and brought it back. However, no evidence of community spread thus far. We also heard from the city of Houston, Dr. Peirce, the leading health official for the city of Houston, explaining that the lab in the city of Houston now has the capability to test for COVID-19. He walked us through that process. You know, there were some testing issues earlier on. Those have been resolved. They tested actual samples today. All appears to be running properly as it should. It takes a day for the testing to occur once it is done. If it's a presumptive positive, meaning that test comes back positive, they then forward it on to the CDC for testing there as well. But in the meantime, if that test comes back presumptive positive, it is an actionable case, meaning they go ahead and treat that patient as though they have coronavirus.
Yeah,
and it is with great certainty. They had said they have no reason to believe that this test result is not positive.
They said it would be rare that for the CDC to then come back and say it's not so. Something that Dr. Jacqueline Mentor with Fort Bend County Health echoed that we've been talking about. So here's what she is saying to the public: remain calm. Do not go to the ER unless you have, you really need to go, that you're in really bad shape. Call your doctor instead. Make sure that you call your doctor. As I said, hygiene. We keep talking about this. This is prevention here. Washing your hands frequently, not touching your nose or your mouth or your eyes. Using, if you don't have soap and water, then have a sanitizer available. Sanitize your workspace, your phones, your stuff at home. One thing that a lot of us forget about, that remote control we wear out. Sanitize it. That's another thing to keep in mind at your home. But I like the fact that she's saying, look, remain calm. This is the only case that we know of in the Houston area, and no cases have been discovered in Harris County so far.
All right. Earlier this afternoon, we spent a considerable amount of time with an expert in this area, epidemiologist, tricky word there, Dr. Catherine Treosi. She answered several viewers' questions. Let's go ahead and have a listen to her now.
Hey guys, happy Wednesday, good afternoon, thank you for joining us. I'm Janelle. We wanted to give you guys kind of a chance to ask your questions about coronavirus to the experts themselves. This is Dr. Kathy Treosi. She is with UT Health. She's an infectious disease epidemiologist. Her title extends way beyond that. So much so that do you want to tell us?
It doesn't matter. The important part is I study infectious diseases.
So she's here to answer all of your questions. You guys can leave them right there. I'm following them along on Facebook, so I can try to ask whichever ones we can get to. You can ask her directly, whatever questions you have about coronavirus, because we at KHU are trying to, our theme is to spread facts, not fear. And I know obviously there's lots of concern going on with coronavirus right now. So here we are, we've got her live right here on Facebook. Whatever questions you have, leave them right there in the comment section. I'm gonna try to follow them along as best as I can and get you guys the answers that you need to maybe just feel a little more comfortable with your day-to-day. Okay, Dr. Kathy. First, I guess let's just talk a little bit about, there's new developments on this every day.
Yes.
Today, we had our first death outside of Washington State, so we're up to 11. just talk a little bit about how this is evolving every day.
Yeah, because you can only find cases if you test for them. And unfortunately, there have been some issues in the United States with availability of testing kits. But as new kits are being rolled out, which is happening this week, we are going to see more cases. It's also the situation that it was only a week ago, not even a week ago, I think that we had our first indication of community spread. That is someone who had not been to China or in contact with someone who had been in China. And if we measure how infectious a virus is by how many people, on average, someone with that virus infects. So it looks like with this virus that about each person who's infected infects about 2 to 3 people.
Really?
So you start with one person, then you get 2, then each of those infects 2. So now you've got 4, and you can see why we're seeing more spread and more cases throughout the community.
This was predicted, right?
Oh yeah.
Yeah.
We knew it was going to happen. And
it's kind of inevitable. I know that it's going to keep spreading, obviously. When does it slow down?
Well, a good question. We don't know. There is hope that in the summer it may slow down, but this is a new virus we haven't seen before, so we don't know that for sure. The other factor is what we as a society do. They're called non-pharmaceutical interventions because we don't have a vaccine, we don't have antivirals. We can do quarantines, as has been done, and if we start seeing a lot of community spread and a lot of illness and or deaths, we will probably start practicing social distancing, which means that schools may close, movie theaters, sporting events may shut down. And we know from the 1918 flu pandemic, which was a long time ago, but we know that that works. There's a famous study of 2 cities, Philadelphia and St. Louis, and Philadelphia did not shut down public events early on, and St. Louis did. And Philadelphia had a whole lot of deaths from the flu, and St. Louis had some, but not as many. So we know social distancing works.
Okay, so at what point do you enact that?
Well, luckily that's above my pay grade.
Okay, well, it's above all.
No, yeah, but I mean, the person who will be making that decision for the city of Houston is Dr. David Pearce, who is our public health authority. And there are many things he has to take into account, how serious the disease is, how widespread it is, but there are also business concerns, obviously. So it's a very, very tough decision.
And then you don't want to incite extra fear if it's not there. And
you don't. And
but you also want to be cautious, so I can see.
And if the schools close, that means parents have to find child care. And so they are not doing what jobs they have, which, so there's a lot of ramifications.
It's really tricky. Okay, let's see if we can start looking at some of you guys' questions. Sorry, give me just a second. Have you been busy lately talking about this a lot?
Yes.
I bet you have. Well, thank you for making time for us today. Okay. Oh, we've got quite a few comments already. Sorry, guys. I've just been chatting away. Okay. Let's start with so Robin says, she says, I'm immune suppressed. Is it wise to have my back surgery in the next couple of weeks?
You know, that's obviously something to discuss with your surgeon, who will take into account the risks versus the benefits. And things are changing so fast, it's just hard to say what will be happening. Think a week ago, how things have changed.
I know, and it just seems to be constantly, but that's obviously something that she should have a conversation with her doctor.
Right.
Let's see. Does COVID-19 contain HIV-like mutations on 4 of its receptors, which would give direct access to our cell?
So, HIV and coronaviruses are both RNA viruses. They're genetic material. That means they can mutate, they can change easily. And I don't know that we have seen any mutations on the receptors. The virus mutated to be able to infect humans in the first place. It came from bats through the pangolin. And so there were some changes.
So it's possible.
It's
a little too
possible,
early.
But I think the question is asking, so viruses enter your cell through receptors, but it already is doing that. So
I see. It's already mutated.
It's already.
I see.
Yeah,
So they have confirmed that it came from the pangolin?
We know it came from bats. I don't know that it's been 100% proven it came from the pangolin, but we're pretty sure that's where it came from.
So that meat market, though, that's still...
Yeah, it looks like there was one event. One person initially got infected.
Okay. Let me see. What happens... Lori wants to know what happens to the body when infected.
The symptom, well, first of all, as I said, it looks like about 16%, so 16 out of 100 infected people have more serious symptoms. It looks like between 2 and 3% die. That number may go down. Most people will have either mild symptoms or maybe more like the flu, but not so severe you need to be hospitalized. And the symptoms are basically the same as the flu. Fever, muscle aches, cough, sometimes diarrhea and nausea.
And so when you say the 16%, those are more severe. Which are those the ones that you're talking about? The fever, nausea, cough?
No, those are the ones that...
Those are the mild symptoms.
Those are the ones... No, I mean, you can have a fever that's 100 or 104. It makes a difference, right? The 16% are the people who probably are hospitalized.
Okay.
Have difficulty breathing.
I see.
But you can have the flu and it be so bad that you have to be hospitalized, or you just take care, you stay home and rest, and that's the difference. And then there's an unknown percent who may have no symptoms. We just don't know because we're not testing for them.
Interesting. And so when you talk about the people who are hospitalized, are these more people who have the underlying conditions?
Yes, and that includes an older age, over 65, and particularly over 70 or 80. If you have diabetes, heart disease, chronic lung problems, those are the people who are more likely to have to be hospitalized and to die.
And what would you say to that population right now at this time?
Wash your hands a lot, stay away from sick people. And you might want to stay away from crowds. We have not had any confirmed cases in Houston, but we will. I mean, it's inevitable. It's inevitable.
Pamela wants to know, what about money being handled, even doctor's visits?
Yeah, again, just wash your hands a lot and try not to touch your face, which is very hard to do. There are studies showing that most of us touch our face about 25 times per hour. I think I'm like double that.
No, me too, for sure. No, you absolutely think about it more.
It's a hard habit to break, but to really think about touching your face. And the reason is that you can inoculate yourself through your mouth or nose or eyes.
Interesting.
So, yeah. And so it's wash your hands a lot. Use hand sanitizer.
Because no matter what you touch, whether it's money, door handles, your phone even. I mean, we don't even...
And we don't know how long the virus can last in the environment. Those studies just haven't been done.
Yeah. Okay, so Deborah's asking, should eating out be not so good of an idea right now? What are the food establishments doing to ensure employees are not infected with virus and they're using good healthcare protocols?
So this raises an interesting dilemma that only about 3/4 of workers in the United States have paid sick leave. And the lower paid jobs, like food handlers, are less likely to have paid sick leave. Therefore, if you are sick, you're deciding between staying home, which would be the right thing to do, and a paycheck, and that may be food on your table or rent. Food establishments need to be sure that employees are not sick when they come to work. The virus is not spread in the way like hepatitis A or it's like foodborne illnesses, so you don't have to worry about your food. But if there's an infected person in a restaurant, they may be coughing or sneezing and you may get infected.
So it's just kind of another one of those things where maybe avoiding, I don't know.
Well,
because you don't want to tell people not to do that.
It is a tough decision, and I can tell you I personally, although I am over 65, I don't have any underlying conditions. I have not changed my daily routine. I am planning on flying to St. Louis in 2 weeks to see my grandbabies. You know, but if I had heart disease or something, I might be
a little more cautious.
Yeah.
And what are you going to do when you go? You're just going to wash your hands?
I'm going to wash my hands. I am not going to mask. It is not recommended. Taking masks from people who need them, healthcare workers. Yeah, wash my hands and try not to touch my face.
And just try to be a little more, I guess, aware of your surroundings. Right. And let's see. Christopher asks, is this a blood-borne or airborne pathogen? And what is the mortality rate here as relates to infection? In short, do we know how to get it and what common sense you can do to avoid it?
Okay, so this is a respiratory virus. It's spread through the air, not through the blood, not like HIV or hepatitis, which is spread through blood. We know that it is spread through droplets. So even as I'm speaking, there are little droplets coming out. If you sing, if you cough, there are droplets. Those droplets have the virus in them, but they're pretty heavy, so they fall to the ground. Gravity catches them, and they don't usually go past 3 to 6 feet. So if you're 6 feet away from somebody, even if they're coughing, you're pretty good. There's another way that respiratory viruses can be spread, and that's through aerosol, and those are smaller particles. We don't know yet whether the virus can be spread through aerosol.
Is that how the flu is spread? Okay, so we don't know yet if it's being spread exactly like the flu?
Yeah, I mean, we talk about the respiratory route, and they're both the respiratory route. It's really that distinction between droplets and aerosol, which is, you know,
interesting.
Sort of arcane.
Okay, so is that an extra precaution that you would, just because that's another unknown that we don't have yet?
No, it's the same thing. Stay away from sick people. Wash your hands. Don't touch your face.
All the same things.
We know that with viruses in general, stress makes your immune system not work as well. So try to get enough sleep. Don't panic, because there's no reason to panic, and because it's not doing your immune system any good.
That is true. Okay, so Gina wants to know, is it remotely unsafe for us to eat something from China or the origin of the coronavirus?
No. It is not spread through food. So there is no concern about food from China, or indeed items that may have been shipped from China.
And Doris wants to know, does hand sanitizer really work?
Yes, hand sanitizer is very effective. Soap and water is better only because if you have some dirt or something like that on your hands, soap and water will get rid of it, and hand sanitizer doesn't really get rid of junk on your hands. But if soap and water isn't available, hand sanitizer will kill viruses, yes.
And there's never a reason to use both, right?
No, you do not need to use both.
You don't need to overdo it a little bit. Okay. Let me see. Frankie wants to know, what about daycares?
We're still learning a lot about this virus, but unlike flu, where the people who are most likely to die from flu are the very old and the very young, under 5 years of age, we are not seeing a lot of infection, and I don't know that there have been any deaths in children.
Really?
We don't know why. Now, again, the situation is changing, but if it were a big problem, we would be seeing those deaths. That's a wonderful thing. So daycare, you know, they're not at higher risk.
It's interesting that there is that one distinguishing factor that we have seen so far between the two viruses.
It is.
So it makes you wonder what exactly it's doing to our bodies once it's in it. That's and obviously something we'll learn.
Yeah.
Eventually. Let's see. How long does it live on things?
We don't know for sure. Those studies will be coming, but there was one initial study that said 9 hours. You know, one study you can take it with a grain of salt.
Sure.
But it does last in the environment. On the other hand, this type of virus, they're called enveloped viruses. They have a envelope around it, and they last less time in the environment than non-envelope viruses. So that's a good thing.
So say someone who was infected coughed on that table over there. The study says that it could last up to 9 hours on that table. Okay, so that's the max probably. We don't know. We have no idea.
It also depends on the humidity and the temperature and some other things as well.
And then if I came along and I put my hand on that table, that's the whole
That's
washing
the
your
whole
hands.
then touching your
washing
eyes
your
and-
hands, for sure. Okay. Let me see. Stephanie wants to know, can you talk about transmission? How is it transmitted exactly? Droplet, contact, airborne? That's droplet.
Right.
That we
and
know
through
of.
fomites, the contact. Fomites are environmental surfaces that, just like you said, you cough on that table,
Mm-hmm.
I come along later, touch it, I don't wash my hands, I touch my eyes, and I can get it that way.
And then airborne, that's the one that we're
Airborne
still...
are the droplets.
Oh, that's still the droplets.
Yeah.
Okay. How long do the symptoms last?
They appear to be, well, again, not every, it looks like not everyone even has symptoms, but we're not testing everybody. So, and it looks like it, for the people who are sicker, it can be 2 or 3 weeks.
2 or 3 weeks. So that's a while.
Yeah.
How do they treat, this is actually my question, when you go, once you are diagnosed that you have it, what is the treatment plan?
So there's no specific treatment. As I said, we don't have antivirals. It's called supportive care. It's basically, if you're seriously ill, it's keeping you alive until your body can get rid of the virus by itself.
And that would be the hospitalization?
That would be the and the ventilator, yeah,
And
to help you breathe.
So outside of the 16%, the people who are showing those symptoms, it's common flu care, go home, rest,
chicken soup,
fluids, all those kinds of things. And that's until your body can get rid of it itself.
Exactly.
Interesting. I didn't know if there was something more going to a doctor would do, but it doesn't seem like.
Yeah.
Unless if you're in that 16%.
People are so worried about being tested, and from a public health standpoint, we want to know who's infected because that tells us something about the spread. But from an individual person's perspective, unless you're seriously ill, and even then, it doesn't really matter whether you have coronavirus or not. You need the ventilator, you need, serious medical care. And if you just have milder symptoms, you're fine staying home. Again, except for studying how the virus spreads, it doesn't really matter because there's nothing specific we can do.
Interesting. Yeah, that's true though, because you're not going to go get a shot and get a cure.
No, and there's no drugs you can take.
Exactly. Okay. Sarah says if you get swabbed for flu and come up negative but still have 103 and headaches. What is that? I mean, that sounds like...
there are a lot of viruses that cause, we call it influenza-like illnesses, ILI. So it could be another virus. So it's hard to tell.
Yeah, and so, but when it comes to...
Also, those tests that swab you are not that specific. Yeah.
Really? And so when it comes to someone showing the signs of symptoms of coronavirus, what are the actual things that the CDC would be looking for to approve them for a test? Because, they have to get...
Well, yeah, and that's changing. It used to be you had to be severely ill and either have traveled in China or be in contact. That is being relaxed as we realize that community spread is happening.
So, but they decide on a CDC level who gets tested, right?
Well, once those tests are rolled out to state labs and big city labs like Houston, then CDC won't be making that decision. They'll be making the decision. And it'll be based on availability of tests. And again, from a public health standpoint, once we find out that coronavirus, the SARS-CoV-2, is in the Houston area, the health department doesn't care so much about, that is the wrong word.
I know what you're saying. No, but I know what you're saying.
Yeah,
they want to know who has it.
Right. It doesn't matter whether I have it or not. They know it's in the community. They know that precautions need to be taken. Right. So public health labs aren't clinical labs like that. And if I were showing those symptoms and I went to my physician, and if I did, I would not be in the, I would not go to the waiting room to potentially infect other people. I would call and say, I'm showing these symptoms. What do you want me to do? Sorry, I lost my train of thought.
It's okay.
So even to be tested then, my doctor might be interested, is this coronavirus? But once we know it's spreading around, it doesn't really matter because there's no specific treatment.
Exactly. It's more to, I think it's more to track it, right?
It's from a public health standpoint to track who's getting infected. And for research studies, because we want to know who's infected so that we know what the fatality rate is, the case fatality rate, and we know, how transmission may be spreading. But with flu, we don't, we track it to see how bad it is in the community, but we don't monitor each and every person that has symptoms.
I'm sorry, guys. I'm getting to your questions, I promise. Okay. How do you test for coronavirus? We kind of just talked about that.
There is a lab test that will test whether you have the virus, not whether you had the virus and are now over the infection, but scientists are working on that.
And this person's asking, should we eat at a buffet at this time? But that kind of goes along the same lines of...
Right. I mean, you're not at higher risk from food. It's really, if you're worried about crowds. Again, we have not seen any cases here in Houston, and not to say that it hasn't, that it's not occurring,
here,
but it's certainly not widespread, or we'd be seeing cases.
Sure. Stephanie asked, how long can the virus live on the surface? There's one study that says 9 hours.
Said 9 hours.
So that's a possibility.
Yeah.
We're not sure. Cassie's asking, can I touch my face after I wash my hands?
Sure.
Maybe like immediately after, but not much long after that.
As soon as you touch the bathroom door handle, you may have recontaminated your hands.
Yeah. So Danielle's saying, is it mandatory that people that go to the doctor with symptoms, you now have to test for the coronavirus as a precaution?
No.
No.
It is not. We don't have enough testing yet.
Yes. And speaking to that, that's something that is changing soon.
Right. CDC is sending out those test kits this week. Hopefully by next week we'll see more widespread testing. And when we see more widespread testing, we will see more cases. It's not that the actual number of cases went up. We just have detected them.
We just know they're there. And so what about COPD and heart patients?
They are at higher risk. If you've got chronic obstructive pulmonary disease, your lungs are already compromised, and now you add a pneumonia or something to it. And the same thing with heart disease. Your heart is already compromised, now you're putting a bigger strain on it. So the case fatality rate is the number of people who have the infection who die, is higher in those patients.
And so those are the people who you may suggest avoiding large crowds.
Yes. But flu also is another issue. Now, the difference is we can vaccinate you against flu. And even though the flu vaccine is not perfect, it does prevent hospitalizations and deaths, and that's what we want to do. So
exactly. And I think when it comes to people who have the underlying conditions, maybe it's just not worth it to even take that risk.
Right.
Even if there is a concern too, to have that in the back of your head.
You have to make that decision yourself.
Okay. David's asking, how long can the virus live outside the body? I'm concerned about all the products we buy from overseas. How are we making sure we're not importing more of the virus?
So as I said, this envelope viruses, which this is, do not last they don't last weeks and weeks in the environment. That one study said 9 hours. So it's not really an issue about things that are imported from China. The other thing is that once we get more, so the odds are we are going to have widespread community widespread. And so worrying about something coming from China, it's going to be here. The virus is going to be here. Mm-hmm. So, yeah.
Okay, so let's see. Danielle wants to know, should people with asthma take precautions and how?
Yeah, asthma is another comorbid condition, just like COPD and heart disease, immunosuppression. And again, you may want to be more careful about washing your hands, about staying away from sick people, not touching your face, and, you know, avoiding crowds. Might be a wise thing to do.
What about traveling? Gina says we're traveling to San Francisco in 2 weeks. Should we postpone?
You know, that's a hard decision. And but I will say that the situation here is changing rapidly. It depends on how late you can wait to cancel your trip. I personally, if I were going to San Francisco, would not cancel the trip now. But, you know, in 2 weeks, if I'm seeing a lot of coronavirus there and not here, that's the other thing. You know, we may have coronavirus here. We will have coronavirus here. And so you may not be at any higher risk in San Francisco than you are here in Houston. But we don't know that right now. So
what about when it comes to people who are hoping to book trips in a month or two?
Have some good travel insurance is what I would say.
Okay.
Yeah. You know,
because what happens when if this becomes spread or comes into the Houston community? What would prevent someone from traveling? Would there be restrictions? There would be restrictions.
There aren't going to be restrictions, although we do see that there aren't flights to China.
Yes.
And Italy and Iran are also, I believe you can't, maybe they're just quarantining people coming in from there. I don't know. But, you know, we can, the airline companies are going to stop flights if nobody's booking them anyways.
Sure.
Yeah.
So just travel insurance? Okay.
Yeah.
I mean, we're all kind of in the same boat where
we're all planning for the summer, right? What
sure.
we're going to do.
Sure.
So, you know.
Yeah. Okay. Let's see. We talked about the virus living out. Okay, we already talked about that one. Okay, Miriam's asking, would the coronavirus affect the food supply coming from China? We already said no. It's not
Well, I
foodborne.
think she's asking a different question. It's not, well, maybe I'm wrong. It's not whether the food is contaminated, but will the supply chain be affected? I'm not sure.
Food supply, yeah, you might be right.
Yeah.
Sorry,
Yeah.
Miriam.
We certainly are concerned about, you know, about supply chain. So much of what we import comes from China. Now they have been seeing fewer cases, so maybe we'll
start
be
ramp
fine.
back up.
Yeah. But I know the business community is very concerned about that.
Have we seen any impact so far?
CDC has.
Sorry, we've got our station running behind us, so it's definitely got some noise back there.
CDC has said that there is one of our concerns are prescription drugs, because a high percentage of our prescription drugs come from China. CDC has said that there is a shortage of one drug, but they are not saying what that drug is. So yeah, we have seen some. And I think Apple phones are affected.
Sure.
And yeah, we have seen some.
But that's the extent of what we've seen so far.
Yeah, I mean we're not seeing shortages of.
We have a question about pregnant women.
Yeah, so again, we're early in the epidemic. When during pregnancy, high fever can be bad. So it's not specifically this virus, it's if you have a high fever with it. We just don't have the data to know whether there is an increase in spontaneous abortions and miscarriages if you're infected. There has been a study of 19 women, so very small, who were infected during pregnancy and gave birth, and their babies were fine. So that's good.
All 19 have already given birth?
Yeah. Whether they were at the end of their pregnancy.
Really?
Yeah. It's been 2 months.
That's impressive that we are that far, that we know
this
that.
China.
Sure,
yeah,
no, I
not
understand,
here. Yeah.
but even that study's been done.
Yeah, exactly. Now, and again, it's early and things may change, but.
Okay, interesting. But if you are pregnant, what would you recommend?
Well, again, I would recommend taking extra precautions. You know, just like I said, wash your hands, don't touch your face, stay away from sick people.
Mm-hmm. All the same stuff. Let me see. if I develop a fever, this is Etney asking, if I develop a fever or any other symptom, how do I go about getting diagnosed in Houston? What if my doctor's office refuses to see me?
Right now, I doubt that someone who's not severely ill is going to be tested because we don't have those kits yet, or they're just arriving. I don't know what to say. I would think your doctor wouldn't refuse to see you. They may not want you to come into the office to potentially infect other people.
Yeah, but that's when we've talked about, you know, calling ahead and letting them know your concerns.
And maybe they'll come out to the car, you know, your car to see you.
Dora wants to know, is being anemic considered a weak immune system, and would the virus be more aggressive?
I do not know of any studies that have looked at people who are anemic. I don't think that affects your immune system.
Okay, and Pamela says, can the virus reoccur once you've been cleared of it?
That is an interesting question, and because, you know, with most viruses, you get measles once,
sure.
right? You get mumps once.
Sure, you get immune.
With influenza, you can get it every year because the virus changes. There are some preliminary studies from China showing that people have been reinfected.
Oh my gosh.
Again, this is early,
yeah, okay.
Not a lot of information, and definitely something we'll be looking at. What I would assume, and the study I read did not have this information. What I would see, I'm touching my face. What I would assume is that if you get it again, it's a weaker, you know, because now your immune system is primed, you have antibodies, so maybe you get it, but you're not as sick.
And Danielle wants to know, how does your body get rid of it? How can your lungs get rid of it once it reaches your lungs?
So our bodies are quite used to fighting infections, and we have an immune system that it made for something new like this that nobody's seen before. We won't have, our immune system isn't primed for it. And that can take a while. It can take 2 weeks.
Is that one of the reasons why we're seeing a longer recovery?
Probably.
Okay, interesting.
Yeah, and so, but eventually, if your immune system is working fine, and you know, the problem is, as you age, it doesn't work so well.
That's life's nice little secret for us.
Right. But eventually, you get antibodies and T cells, and it fights the virus and makes it go away.
But that doesn't, but because it could mutate means that it's a possibility that
you could see it again.
That's the early result. That's a very small study in China that we still, okay.
Right. But, I mean, it's important when we talk about a 2% case fatality rate,
sure.
2 out of 100, it's terrible for those people, but 98 people have survived.
Yes.
So most people's bodies do get rid of the virus.
And I know we were talking before about that death rate, and with the number of people who haven't been tested, who may have just fought this off on their own, that death rate, that's probably the highest it could be.
Yeah, probably.
Because
we're only testing those hospitalized severe patients and who are more likely to die. The person who has a milder infection, we don't test, and they're not going to die.
Which could be so many more people.
Which could be so many more people.
Which would drop that death rate. And I think that's a good thing for people to realize.
Right.
Just because the more calmness you can have, I think the better. Okay. What's the incubation period?
It looks to be between 2 and 14 days, although there have been a few studies that show it might be longer than 14 days. But the generally accepted number is 5 days on average.
Oh, really? 5 days. Okay. Glinda says, we have trips on cruises in May and October to Italy. Do you think it's safe to go? Oh.
Yeah, well, you know, cruises are
rough
a lot
anyways.
Of people together. And it's just hard to say because the virus may disappear by May. It is just hard to say.
Really?
Yeah.
That's so interesting. Okay.
And you know, October, if the virus comes back, which even if it goes away this summer, it will probably come back in the fall. And October is the start of flu season. So if this virus acts like flu, you might be.
So I did read that somewhere that it may now be Will it be a seasonal thing?
Yeah, it's called endemic. It's just around all the time. Yeah, it's like seasonal flu.
So it might be something that we'll see.
Right. But, you know, this time that we're seeing it, everybody's seeing it. Everybody's body is seeing it for the first time. Nobody has immunity. Next, you know, if it comes back in October, some percent of us will have fought off the infection. And even if we're not totally immune, like with flu, we'll have a milder infection.
And so why would it go away in the summer?
Good question. We don't really know about why flu goes away. Some other theories are that the virus is less likely to survive in the environment when there's higher humidity, which means we should never see it in Houston.
Ever?
Right?
What?
Yeah.
I mean, my hair today is like there's no virus around.
Yeah. The other reason, speculation, is how people interact. That in the winter, kids are in school. And kids are a really good way to spread any infectious disease.
Interesting.
Yeah, and so in the summer you just don't have that as much opportunity for spread.
So could it be a combination of that?
Oh, absolutely, and probably other things we're not thinking about. Now, when it's summer here in the northern hemisphere, it's winter in the southern hemisphere, and they are seeing flu every year.
So it's opposite.
Yeah.
Interesting. Yeah. Okay. Can I catch the virus by eating food cooked by other people?
Not unless they cough or sneeze on you. The food is going to be fine.
Food itself is. Let me see. Clorox, Lysol, alcohol, all which are preferred disinfectants.
Yeah, a 10% alcohol solution. 10% Clorox solution will kill viruses. Lysol kills viruses. Alcohol, you have to have it 70, 80, 90% higher. So not, I've seen a hand sanitizer do-it-yourself recipes that instead of using rubbing alcohol, which is 90+% alcohol, instead they recommend vodka, and the highest percent of vodka is only around 40. Vodka would not, although why would you want to waste your vodka disinfecting your table, right?
It's a great question. Yeah. Let me see. Could it mutate? We've kind of talked about this a little bit.
It is an RNA virus, and RNA mutates pretty easily. There is a report out of China yesterday, I believe, it could have been today, saying that it has already mutated, that there are 2 strains. Now that was, again, a very small study. We'll see. But the virus mutated originally to infect humans. So some change in those cell receptors.
And this is what you were talking about, why maybe someone could be infected twice. Interesting. Okay, so do you know these numbers? Tim's asking how many people have died due to coronavirus in the U.S. compared to the flu this year?
I do know those numbers. Let's see, the death rate is 11 for coronavirus. Since October 1st, which is when we start counting for flu season, estimates are that 16,000 people have died from influenza. And this isn't a particularly bad season.
It is or it is not? Is not, okay.
Yeah. We've actually seen this year more pediatric deaths because of the type of flu that's circulating. So I don't know, last week it was 109 pediatric deaths. I didn't look it up this week, but it's the second highest number ever recorded.
Wow.
Yeah.
So someone, Jesse asked us, do current pneumonia shots offer any help?
No.
Okay. Where some people are talking about the death rate, which we've also discussed. Why haven't all medical facilities begun testing all patients suffering from pneumonia as a first place to find where the virus and who has it?
That would be a good thing to do if we had the testing kits. And the original testing kits that CDC sent out had some problems. They had to recall them. They're now, they revamped the testing, and those kits are being sent out, but we just haven't had the capability to do it.
And this is a good conversation some people are having. Can you boost your immune system to help you fight the virus a little better? Are there any vitamins you can be taking?
Not really, but just, getting enough sleep, trying to reduce stress, eating well, exercise, those things all make you healthier and help your immune system.
Are there any vitamins you'd recommend people just to be taking on an everyday basis? No? Okay.
There are a lot of studies showing
Get some
we
sleep.
don't.
That's your vitamin.
Right.
Okay.
Vitamin S.
Is it safe to give babies pacifiers?
Well, if it dropped on the
clean,
floor, I might not
yeah.
want to, but yeah.
Make sure it's disinfected before
sure
you do
it's
that.
clean.
Any known cases of children having it?
I do not know of any cases of children having it. I think once we start testing more, particularly for asymptomatic infections, those infections that don't have any symptoms, we will find it. But I don't know of any cases.
Tiffany says, I work for a doctor's office. How do we protect ourselves?
So you want to make sure when your patients come in, as I said, that they are not infecting other people. Healthcare workers are at higher risk, and in a hospital setting, if you are a healthcare provider, you would be masked if you're around people who have the virus. We don't recommend that for other people, but you are at higher risk if you're a healthcare provider. Again, it's just common sense hygiene messages or practices. But you are at higher risk. That's just the bottom line. Same with flu, although again, the difference is you can be vaccinated.
So when it comes to the masks, why do they not work?
The surgical masks, those green or white ones that you see, are to prevent, if I were masked, it's to prevent me from infecting somebody else. They don't fit very well here, and so air and particles can get in and you can still be exposed. There are other types of masks called N95 masks. The 95 mean that they clear about 95% of particles. Those are what you would use in a hospital setting, but they have to be fitted to you. There are different types, and it depends on how big your face is, and you have to, there are tests you can do to make sure that it's actually preventing particles from getting in. The other problem is, we've seen a shortage of masks because people are hoarding them, and healthcare providers need them. And when other people that don't need them are using up the supply, that can be a problem. The other reason they don't work is, besides the fact that there's not a tight seal, particularly right here, is people need to cover their nose, which they may not do, and they may still go under the mask to touch their face. They may wear it too long, and it may give them a false sense of security, so that they don't wash their hands as often as they should.
Yeah, that's what I would think would be the main problem, is that you think that you're okay, you don't take those other precautions that the CDC and everyone is telling us that these are the things that you need to do. Right. Okay. Chloe's with us here. Chloe, how are we doing? We got any more questions? What about animals? Have we seen any evidence of this hurting animals?
I almost hate to say this, but there was a report again yesterday or the day before out of China that a dog was infected. We do know that animals can have their own coronaviruses. This is one dog, one test, and so I certainly am not saying that is what's happening. But of course people are going to be following up on it. The other thing is that we don't know, even if this dog truly was infected with SARS-CoV-2, that whether it can infect humans.
And so how many studies do you think are being done right now on this virus?
I think a lot of studies are being done, but until we can test more people, a lot of that information is going to be lacking.
Interesting. And do you think the virus we're seeing here is different than the virus they saw in Wuhan?
I don't know. And as I said, there was one paper published showing that the virus has mutated. So I don't know. People will be looking at that.
When we say mutated, would we see any difference in symptoms? Would we see any difference in the virus? What does mutated actually mean?
Well, mutated just means changed. So sometimes viruses mutate and then they can't infect humans. So that would be good.
That'd be great.
Yeah, yeah, go ahead. It could mutate that it's, so, okay, I'm going to get technical here.
That's fine. We'll try to follow, okay.
The reason people die from this infection is because the virus gets in their lungs and they can't breathe, okay? So that's your lower respiratory tract, and that your body temperature there is higher than it is in your nose. Upper respiratory viruses, like the common cold, you don't die from the common cold. You might feel like you're going to, but you don't, because it's infecting here, not your lungs. So the virus, this virus right now appears to be infecting both the upper respiratory tract, so your nose, your sinuses there, and that may be people who have milder symptoms. In some people, it appears to go down to their lower respiratory tract, and that's when they're more seriously ill.
Does it start here?
Yeah, because that's where it's coming in.
Okay.
You know, you're breathing it, yeah. We don't know why that happens to some people. But back to your original question.
I'm sorry, I'm all over the place here.
No, it's me. The virus, if the virus changed, mutated so that it was more likely to infect your lower respiratory tract, or less likely, then we might see differences. Probably not in symptoms. It's still going to be fever, cough, you know, that kind of thing. But less, if it were less likely to infect, then less pneumonia. So yeah, we could see some differences, probably less likely in symptoms, but in how the virulence, how bad the infection is. And also it can mutate and become more or less transmissible between humans. So.
Chloe, I could talk to her all day, so you cut me off.
No, I mean,
you cut me off.
Your world.
You cut me off. I was going to ask, when it gets into the lower tract, have we seen people come back from that?
Oh yeah,
absolutely,
definitely. You know, so 16% of people, it looks like right now, have the more serious infection, and those are probably people where it's in their lower respiratory tract. Of that 16%, not everybody's dying. You know, only 2% out of everybody's dying. So yeah.
So that's the difference.
But you need supportive care in the hospital. You may need a ventilator. You may, you know,
sure,
to help
you breathe, to help you.
Right.
And so that's what we're talking about. The difference in the 16% is that. Well, I don't know the math. What is that? 88? No, 8. Oh gosh, don't make me do this. 84. 84% of people, it would stay upper. 16% it would go lower. 2% it actually can be fatal.
Yeah, I mean
roughly, roughly that.
And it may be that in the 84%, maybe they do have some lower respiratory infection, but their body is taking care of it.
Sure.
So they don't get pneumonia.
Interesting.
And they don't need to be hospitalized.
Okay. All right. Do we have any more questions? Oh, we have more questions. Okay. My husband's in EMS. What do you recommend?
You know, EMS, I'm not sure.
Kind of the same thing?
Yeah, I mean, but I don't know how often EMS would be, personnel would be exposed. You know, would you call an ambulance to pick you up? I don't know.
Oh, true.
You know,
That's
I'm
true.
not sure that the exposure would be that much. Certainly not right now, because we're not seeing it.
So once the first tests are confirmed here in Houston, because we know it's inevitable,
it will happen.
Will they be quarantined?
Probably. So the Public Health Authority in a jurisdiction, which, as I said, for Houston is Dr. David Pearce, has the legal authority to quarantine someone. He and every other public health authority is very reluctant to use that.
Sure.
Sometimes it's necessary with TB patients. He would instead hope that he could convince the person, the infected person, to self-quarantine.
At their home.
At their home, right.
I think if you give them the two options, they'll probably be like, I'll stay home. I'll stay home. Let me see. Someone asked if a CAT scan can detect the virus.
No.
No, okay. If you're over 75 and have COPD, should you wear a mask in public places?
Again, the mask doesn't really protect you, although there have been some studies that show with flu, people who wear those masks, even though they're not perfect, are less likely to get the virus. That's a personal decision. It would probably be better just to stay away from crowds.
The public places, just because it's not worth it.
If you can.
Okay. Should we pull our kids out of school?
Not at this time.
I think that they'll stay on top of that.
Oh, absolutely, absolutely.
Yeah.
Meetings during disasters or outbreaks, the city health department, the county health department, the state health department, CDC, they all have what's called incident command structure, and there's daily or more than daily briefings, telephone calls with the state and CDC. I mean, yeah, your public health people are on top of it. Now, I have to say that funding for public health has been cut. There are programs that have been cut, so I would say that public health is on the ballot in the fall, and you know,
keep that in mind.
Public health is out there protecting you, and if they're doing their job, you don't know about it because there isn't an outbreak. You don't get sick eating at a restaurant. Your air quality is good, so yeah, it's important.
What's your overall view of coronavirus right now? Could it have been worse? Is it as bad as it could be? What do you think?
I think we just won't know. I think that we are going to see widespread coronavirus. What we don't know is if it will be mild, moderate, or severe. It could be very bad. It could be very mild. And people get sick, but they're not dying. It doesn't disrupt life. I think what's maybe more disconcerting right now is the false information that's out there that's panicking people. It's important to get your information from credible sources like CDC, WHO, your local health department, and stay, be prepared, but don't panic.
Be prepared, but don't panic. Those are good words. What do you think, Chloe?
I think we're good.
Thank you guys for your questions. Thank you so much.
You're welcome.
For answering my million questions today. All of mine too, as well as you guys. But thank you guys for tuning in. We hope that we answered a few of your questions, calmed some of your fears. But we'll be covering coronavirus for a while. So. Yeah. For a while. So just stay with us. I know coming up later today we have more stories going on, so stay tuned. And we will see you guys next time. Thank you so much.
You're welcome.
Thank you. Bye, guys.